Well, there will be other people that will join, but it's 4:30. I'll start in a minute. And realize this is being recorded, so people can listen later, and there should be time for questions. This is only current up to this morning, as of this morning's news. So things will change a couple days from now, also after the FDA and CDC meets. But I'll try and cover things that will be pertinent, particularly locally also. So just to start off, a brief review, just very brief. Viruses need a host for energy. They don't survive long on surfaces. The respiratory ones are transmitted through the air almost 100%, rarely through any contact. Vaccines boost your antibodies, just like an infection does, due to whether it's a virus or any other infection. Antibodies always decline following an infection or a vaccine, but they still may have adequate antibodies for months afterwards, or be recalled quickly anytime in the future, even for years. Now, studies are looking at what a minimum level of antibodies is to be protective against COVID. And there are some studies that show that they probably know what's protective given a particular assay, but there are many different labs measuring it many different ways, and there's no unanimity. So the only proof that you have adequate antibodies is that you don't get infected or get seriously infected with time. So that's why it takes time to figure out whether these vaccines work as long as they do. You can't just do an antibody test at present. In the future, that might be the case. And in testing children, they might be able to do antibody levels in order to tell whether it's good enough or not. But that's all kind of research still. So 4 vaccines right now in the United States that are approved. There's a couple others being used other places in the world. There's still about another 20 under study. Some of them may not give long-lasting protection, and they're going to have a hard time getting any traction because the ones that are out are pretty good. Viral variants. There have been viral variants which are really just mutations noted in the first few months of the pandemic, but not all of them are infectious or worse. They may have some advantage, but then they could also be neutral or even be disadvantaged, so that only the ones that propagate better are then given a label, either a virus of interest, or if they're circulating widely, a virus of concern. And if they're really circulating in an area widely enough, then they're given that Greek alphabet tag. Alpha, beta, and delta is the one that's circulating so much now. There are other variants. There are already about 1,200 mutations in the first couple of months. There's always mutations going on. Could it be suddenly something so terrible that it would wipe out everybody? That doesn't happen. If something is so virulent that it kills everybody quickly, then it dies off very quickly. That's why Ebola doesn't take over the world. But it could be worse than Delta, but most of the mutations have no advantage to them. So these other ones that you hear occasionally in the news, there's other ones that they give labels to, lately Mu and another one. It's not clear that they'll gain any traction at all. So stay tuned. So far, the vaccines that are approved, although they were never 100% effective in preventing all symptoms, they're still about 99% protective against severe disease or deaths. There is some waning, and we'll get into that. The breakthrough cases, which is what people are particularly interested in because so many people are vaccinated here in town, they do occur, and we'll get into the local breakdown in a little bit, so that the people fully vaccinated can get symptoms, but many of them are also just testing positive because they're part of a routine screening, because they work in a hospital, because they go to a nursing home, because they're students or travelers on planes or whatever. So those people testing positive are more frequent 6 months later as the antibodies wane. But severe disease and deaths and hospitalizations are still rare. But as I'll mention, there are 2 people that were fully vaccinated that have died in town in the past week. It's not impossible. The people that get sick tend to be ones that are older. They have other risk factors, and we don't know always where their exposure was. Maybe they were really not careful. The people that are immune suppressed are always going to be at increased risk, and that's about 3 to 5% of the adults. They've already been approved for a booster vaccination. They can just go to a store, go to the hospital site at the mall and say, I'm immune suppressed. They don't have to prove it, and they can get a booster. They still may not get a good response to the vaccines, but it's worth a try. Can you measure antibodies to see whether you got a good response? You can. It's suggested that you not do it because nobody knows the level of antibodies that are proven to be protective. But it's not unreasonable for somebody that's immune suppressed to get an antibody test about 3 weeks later is the optimal time. And you have to make sure you get the correct antibody test, though, to see whether they did get antibodies to it. Because if they didn't, then they know they're still at increased risk. If they did, they can feel better about it, but they really don't know how well they're protected still. Remember that in addition to the antibodies that you can measure, we also have long-lasting memory cells that are called T cells or memory B cells that may still protect you from serious disease. I mean, what about all the childhood vaccinations we got? We don't have huge levels of antibodies to those 20, 30, 50 years later. We have very small antibodies levels to them that you can measure in some cases. But we still have some memory cells around that can quickly ramp up, so that you usually have lifelong protection from the childhood diseases, certainly if you have the disease, unless there's a mild recurrence, and from almost all the vaccinations, but that's a separate topic. So whether a booster is needed is a question that was raised by Biden and the FDA head a couple of weeks ago and said, let's think about giving boosters 8 months after the second vaccination, starting on September 27th. That was actually premature and was and continues to be criticized by the other people in the FDA and the CDC that are actually having to come up with recommendations for it, and another group called the National Vaccination Council, anyway. But it is not likely that the whole country will be advised to get boosters on September 27th. They're starting then. The reason why they suggested that was based on some data from Europe, mainly Israel, that showed that there was some waning of immunity and a few people were getting ill 6 to 8 months after their second shot. But that's been criticized, and the data on that is really not clear. There's other data that shows that it's still extremely protective, about 97% plus. And although we can't say for sure what will be decided when the FDA and CDC meets this Friday and Saturday, and it's supposed to be televised somehow, and open to the public. What is likely is that it will be approved for the people over 75 or people that are under 75 that have other serious problems. Those are determined, and the healthcare workers in the nursing homes and hospitals, etc. So that's yet to be decided, but it's not so likely that it will be advised for healthy people under 50, say. They would rarely get sick enough that they would need to be even in the hospital. So stay tuned. Right now, it's still the pandemic of the unvaccinated, which means that the severe cases are 97% plus among the unvaccinated people or someone who only got one shot. And what to do as far as a mixing of boosters, if you got the Moderna, can you get all that is to be decided. Stay tuned. What about the risk to children, since those under 12 can't be vaccinated?
Found Costello.
If you don't, yeah, if you don't vaccinate, pardon? Did you have a comment? No, I'll go on. Obviously, the kids under 12 can't get vaccinated. And one thought to keep in mind, we'll see what happens, is it's possible that it'll be recommended that some group of kids, maybe those under 5 or those under 3, may not even warrant getting vaccinated since they're so rarely ill. Although we'll talk about, wouldn't they then spread it? Well, not so likely, but those kind of tough decisions will be visited and then revisited and revisited as the data comes in. Some countries have already started giving a third vaccination to people over 65 or 60. Britain just decided yesterday to give it to people over 50, plus some people with underlying health conditions younger than that. Each country is looking at similar data and making somewhat different decisions. So the WHO and those countries that have very few vaccines are crying that you shouldn't be giving people third vaccinations when it's so unlikely to be helpful when so much of the world is unvaccinated. But again, these are really tough questions and continue to be visited and revisited, and no doubt will change. Of children getting sick, they rarely get sick enough to be in the hospital, but it's not impossible. Of New York State deaths so far from COVID, there have been about 43,000 total. Only 30 of them were under 20 years old. And most of them had only some other risk factor, like they had cystic fibrosis or some other serious condition. Of the people that are testing positive now, in the last couple of weeks, it's about 25% of them are under 18. And that's likely to stay that or a little bit higher since the schools are open. But still, even with the Delta virus spreading, again, it's the chances of being hospitalized are very low with children. It's only about 2% of all cases versus adults who initially got COVID early on in the pandemic tend to be older. At least 10% of them were being hospitalized. Now it's mainly the people between 20 and 50, a smaller percentage, but I haven't seen the percentage, probably closer to 5 or 6%. There are long-lasting symptoms in some people that test positive, even with mild symptoms. That is possible. Those cases have been looked at in pediatrics. It's got a name. Means something like long COVID, but of about 4,200 cases so far in the US with a median age of 9, almost all of those are better by 4 months or 6 months later, even if they were in the hospital. So they almost all rebound, but not all of them. School workers, about 80% were vaccinated so far, more so in New York City and some other places that are going to mandate it. 35% of New Yorkers aged 12 to 15 are fully vaccinated versus 85% 65 and up. We're not likely that we're going to get close to 100% of the kids vaccinated because there's about 20 to 30% of adults in the United States that are still holding out, some of which might be mandated to get the vaccine. We'll touch on that. But it's not likely that we'll get any more percentage of kids vaccinated unless it's somehow mandated than the adults that are getting vaccinated. So will that be enough to achieve what's called herd immunity? Nobody knows, and it's all guesswork. If you look at herd immunity, originally people thought maybe 70% of people getting vaccinated or having the disease would be enough so that there wouldn't be enough cases around that it would propagate. But with the new variants, such as Delta, that are transmitted more easily, nobody knows what that figure is. It might be 85% of people. It might be 90% of people. Measles requires about 95% of population to be vaccinated before you don't have any big outbreaks. You'll just have small outbreaks. Will we need 95%? Again, nobody knows, and only the test of time will tell us. So there are more cases in kids. They're rarely serious, but they sometimes are kids that are dying from it also. With the vaccinations now being required in some parts of the country, New York State, for teachers, healthcare workers, etc., there is an opt-out almost always, and that's the same for what Biden just determined for for some worker groups, and we'll mention that in a minute. You can opt out if you get a swab test once a week, say, so that it's not actually mandating the vaccines when you give that opt-out. That's one way that the rule that Biden has passed will no doubt pass a legal challenge. Those rapid tests, the ones where you do a swab, you put it in some media and you get results in 15 minutes, are not very accurate if somebody does not have symptoms. They only pick up about 70% of cases, whereas if you also did the swab and did it by a PCR test, which magnifies the amount of sample, you would pick up 100%. Also, in people that are getting symptoms, they sometimes test negative the first couple of days also, even by the best test. But by the time you get to the 4th or 5th day, even the rapid test would be likely to be positive. And the thing about doing the rapid test is if you're doing it every week, or in some cases a couple of times a week, then you'll pick up people that they maybe were sick on Monday, but they weren't positive enough to turn positive with the test. You'll pick them up on Friday, though. Then you'll quarantine them. They wouldn't have been able to have spread it very much in the intervening days if they continued to do what everybody should be doing anyway, keeping distance, wearing masks indoors, etc. So it's helpful to do the rapid test if you're doing it fairly frequently. One problem with the rapid tests is, and this is kind of crazy, but one of the companies that made the rapid test, Abbott, saw that if people were getting vaccinated and they weren't doing so many of the rapid tests, they destroyed a lot of their test materials. And now all of a sudden it's going to be in huge demand, and the companies that make these are racing to catch up because there's going to be huge demand given Biden's directive. For those people on this call, most of us are in the over 65 or so group. Realize that the symptoms in people over 65 may not be the typical cough. You may just be tired, confused, or even have diarrhea. Although 50% of people have the typical cough, terrible aches, etc., there are atypical symptoms. So keep that in mind. If you're having symptoms like that, don't dismiss them. Just briefly, and I won't spend much time on this, why are vaccinations of kids taking so long? There's a number of reasons, mostly because unlike most of the childhood vaccinations, it's not the kids at risk, it's the adults, the older adults. Given that the kids are also getting sick less often, it's going to take longer to see how effective the vaccines are for them also. There are a number of reasons why kids are less susceptible, but we won't get into that. The local cases, as you know, have really spiked since the end of July, when it was encouraged that we wear masks indoors. On August 9th, the health department said everybody's required to be wearing masks indoors, and encouraged to be wearing them also if you're outdoors in crowds and trying to stay 6 feet apart, etc. Those cases, as you've seen, have been gradually going up. And beginning in early August, there were about 1 to 4 cases in the hospital again, where there'd only been 1. Now, the last couple of days, it's about 9 to 11. And there have been 2 deaths in the past week of people that were fully vaccinated. One was 93 and had some other risk factors. The other one, I don't know the details, but I imagine it was the same that they, so that the risk, though, to being hospitalized, if you come down with COVID, it's about 10% for adults, and around 10% of those may die from it. That's about 1% plus overall. For the people that are vaccinated, your chances of dying then when you get COVID is about 1 out of 100, roughly, depending on other factors. If you're vaccinated, your chances of getting it and dying are about 1 out of 1,000. So it's not zero, but the vaccines are still very effective. They're not perfect, however. The number of cases, active cases in town, was over 400 about 2 weeks ago. Now it's down to about 200. And those people are being quarantined and followed up. It's not all Cornell students. I took a look from 3 days ago. Only 10 of the 26 cases that were positive in town were Cornell students, and just much less in the Ithaca College community. So it's, and I don't know who the other people are, but the health department says it's people that go to weddings, it's people that go to parties, it's people that go to crowds, and people that don't wear masks. Of the people that are testing positive, they also are asking them, do you think you know where you got it? Only about 50% of people think they know where they got it. Now, it's possible that some people are lying because they didn't want to say, oh, yeah, I was at this party with all these other people that weren't masked. But as far as we know, it's not always obvious why people are testing positive. So wear your mask indoors around other people that are not in your safe pod. Everybody should be wearing a mask in the store, although I'm not really worried about going into a store briefly, walking around, not being close to somebody. They don't have a mask. I'm not going to yell at them, but they should be wearing a mask. You'll notice that almost all the store personnel are wearing masks, as they should, because they're standing with people directly in front of them for a while. So there are other vaccinations that have been given out around the world. The Chinese ones aren't as good. I won't get into that. There are more and more people debating, do we need to vaccinate all the kids? This is going to be a lot of back and forth. You'll hear people with pros and cons for this in the coming weeks and probably months. There is some suggestion that these different waves tend to come on and fade after about 2 months. Nobody knows why that is so far. Is it because, as in many states, like the southern states, they loosened up their restrictions on wearing masks and indoor events and things like that? That's probably part of it. But this also seems to be going on around the world. No one's exactly sure why it is, but it's probably a combination of another variant that comes along that's a bit more transmissible, and people are letting down their guard. If everybody masked, stayed careful, distant, etc., plus got vaccinated this fall, as you see, the resistance to vaccination, which is pretty rock hard in about 20 to 30% of people. Now, there was the Biden dictate that the workers in businesses that have more than 100 people, and also federal workers, federal contractors, etc., get the vaccine, or they can test once a week. A couple things about that. Some states and cities have already mandated it. It's probably legal to mandate this because he allowed the testing possibility. Current events, a couple of weeks ago, a 1905 Supreme Court decision that said that states and city localities could mandate smallpox vaccination because people opposed it back then and have opposed various vaccinations over the years. So it should be that that will stand up. His dictate did not oppose the national mandate. It limited it to federal workers, contractors, healthcare workers, hospitals, nursing homes, etc., to get federal funds. And it allows the weekly testing also. This is under the OSHA authority, which people may test in court, but probably will hold up. It's felt likely that it would be. Realize that it actually applies to those states that do not have their own OSHA equivalent occupational safety and health authorities for their own states. Those states that do, it might not apply for them, but most of the states that are having outbreaks don't have their own OSHA equivalent in that state. So there's some legalities that you'll see about this coming up in the next couple of weeks, but it's likely to fly. The Republican governors that are opposing this mandate are in states that all require childhood vaccinations, and most of them also deny religious exceptions also. But they try to say that this is different because it doesn't have the same experience as the childhood vaccinations. And there's all kinds of reasons why people are opposing religious and personal freedom and all kinds of other reasons about the Supreme Court. Again, I mentioned 1905. The elected bodies, such as a state legislature or a school board, which is elected, when they have duly considered things and passed something reasonable in special circumstances like a pandemic, there's good reason to expect that that will be legal in every place in the country. I realize that in the past day that there was a judge in New York State that said that he put a hold on the New York State dictate, in that those people that claimed a religious exemption could not be required to take the vaccine. I don't believe that'll hold up, but we'll see. It still kept it as a mandate in New York State under the governor and the health board's recommendation of a couple of weeks ago. For all those people that don't claim a religious exemption, there's always a medical exemption if somebody had a terrible allergic reaction to a previous vaccine, although that's even been given to people that have had allergic reactions, and almost all they tolerated fine, but it needs to be done very carefully. So those mandates are likely to be held up. The booster shots we mentioned is going to be talked about in the next couple of days, and just a little bit more about the data behind that. It's mostly based on Israeli data, which has a good database there of their population. And it's really in question, though, because the people that were starting to get sick are the people that have been vaccinated early on. They tended to be the wealthy and more likely to be less careful. So it's not clear that they were actually having their immunity wane so much as they were not behaving well. So that's where a lot of the question is being raised about whether that's really true or not. Let's see. Yeah, Governor Hochul, August 24th, noticed that she asked the New York State Department of Health to mandate masks in schools. For a governor to mandate it, or like DeSantis in Florida, to forbid a mandate, is probably illegal. And that's why several of the people that have challenged it in Florida have won that case, although there's another judge that ruled differently. Because what gets together with legislatively elected people that represent the people, and they talk and make careful consideration and make it public and reach a decision, it should be able to be endorsed and legal. So that's probably the way that the Republican governors that are opposing it are going to have those rules against the mandate be tossed out. Sometimes people question, do masks help? There are one or two studies in which they're poorly done and they didn't really make a difference, but they were not well done. They didn't really carefully watch what people did outside of work, etc. There are lots of studies on groups of people and whole states that show that masks make a difference. If everybody was masking, through the air unless you're close to somebody, less than 6 feet, directly talking to them, say for more than 10 minutes, is the current advice from the CDC to say that that puts you at risk. So, can unmasked vaccinated people gather? We're almost all vaccinated in our cohort. You could do so outdoors, certainly, but you wouldn't want to spend 10 minutes talking to somebody across the picnic table without masks on. If you're indoors, you could be unmasked if you're in small groups in which you know people have been very careful, they haven't traveled, they haven't exposed anybody that hasn't been vaccinated, they're fully vaccinated. They're not around anybody else that has particular health problems. Any larger groups, people should definitely be wearing masks because there are so many people, you can't go around and interview all of them to find out what their risk factors might be and what their exposures might be. Because we are still at increased risk, and there are people that do get sick and even die. The cases now are about 40 million in the United States. 1/4 of the new cases are in kids, though they're only 2% of the hospital cases. 75% of adults over 18 have at least one shot. 64% are fully vaccinated. And yet, despite all this, the cases on this Labor Day were twice as many as they were a year ago on Labor Day. So you're also keep in mind, if you come down with symptoms, as I said, some can be atypical in our age group, that if you test positive at our age or people that are younger with other health conditions, there is a combination antibody treatment that can be given to you. You don't even have to have symptoms if you're a household contact of a patient. There is a number that the health department has that if you call it up, they'll fast track it to get you in for the antibody treatment, which is helpful. Realize that if you don't get the antibody treatment and you are a vaccinated person and you had an exposure, your risks of becoming hospitalized are about 9 or 10%. If you did get the antibody treatment, your risk is about 1 to 2%. It lowers your risk about exposed, and this is the last thing I'll mention. Even household contacts don't come down with the virus, even if they weren't vaccinated. If you're having a prolonged close exposure, there have been times when there have been, say, fishing boats. Everybody's on a fishing boat for 2 weeks. Somebody is sick. Almost everybody gets sick. They're in small quarters. They can't separate. If you're in a household, though, the risk of transmission is around 15 to 25%. It's a little bit higher if kids are of a certain age, because they don't cover their nose, whatever. But smaller kids also, they expel less virus because they're smaller and they're closer to the ground. So that there are plenty of cases in which a spouse gets ill and the other spouse who's with them all the time does not. It's not always clear why that is, but you don't have to feel that you're doomed if someone else is close to you and turns positive, but you should certainly be on the lookout. And if exposed, you go to the Tompkins County Health Department website. They'll tell you, get tested in 3 to 5 days, take other precautions, etc. those are the points that I wanted to make, but there must be plenty of room for questions.
I got exhausted.
John?
Yeah.
Hi, it's Ann Lemley. I just thought of something that's rather interesting, and that is that Israel has only been using the Pfizer vaccine. So, and I was interested in your possible explanation of the careless rich with needing the boot. But at any rate, those data may not carry over to other vaccines, right? I mean, one of the things I've read recently is that Moderna used a different amount of not antibody, but what they use to put in to mRNA. Anyway, they're different. They're not identical, even though they're both mRNA vaccines. And then you've got the Johnson & Johnson. And then England is AstraZeneca primarily. So yeah. A lot of these things that are happening in these numbers are also possibly a little bit dependent on the vaccine. Would you think?
Yes, and it turns out Moderna actually gives you better antibody titers, although they have similar efficacy against serious disease or death. And the other vaccines, although they are not quite as good, the J&J and AstraZeneca versus symptoms, they're still about as good, just a tiny bit worse as far as hospitalization or death. They're very good, but they're not quite as good by so many different countries that we're learning all the time. And realize in the United States, when you got your vaccine, they asked you, did you want to sign up for the VAERS program? Of the first 100 million, about 10% did. That's at least 10 million people that are being tracked as to what's happening with them. I just got my 6-month reminder the other day to say, how are you doing?
Yeah, I did it too. Yeah.
Yeah.
I always feel like someone cares about me when I get one of those texts.
Yeah. So although it's true, there are some people that say, well, these vaccines haven't been around for very long. We don't know what the long-term side effects are. That is a legitimate criticism. However, you can also say it is more studied in numbers than any vaccine in the history of mankind because of the internet connections. I mean, people have talked about, how to convince someone that doesn't want to get the vaccine. There isn't an easy way. Generally, it's said, listen to them, have them say their piece, then you can perhaps suggest some other ways for them to think about it. But to just dismiss them is of no help. And locally, the mandates also are going to create, and around the country, a crunch on healthcare and nursing home care. About 20% of nursing homes plus, and maybe less in hospitals around the country, although I think our hospitals around 95%. There are people that are not going to get vaccinated that are staff at the, and those people are going to be let go unless there's some change in the mandate, which is, it could happen at the last minute. It's possible that there will be a crisis in healthcare workers 11 days from now. We'll see. Other questions?
Yeah, John, is there a, by the way, this is very informative. It's really very helpful. Thank you for doing this. Is there a disadvantage if you qualify to getting or any downsides to getting a booster? Even if you've met the 6 or 8 month threshold and the age threshold, it sounds like you don't really know if you need it because you don't know how your immune system has responded. You don't know if the memory cells are working sufficiently so you don't really need a booster, but if you get a booster, are there any downsides to doing it?
It's unknown, but from the limited data that people have been tracking, no, and there's no reason to think that that will be the case, that you'll get some terrible, you might be a little bit more ill, but from the limited data that's being seen of people that have been tracked after the third dose and around the world, it doesn't seem to be happening.
Thank you.
You can go, actually, you can walk into the pharmacy, Walgreens, for example, yourself today and get a booster. There, I know somebody that teaches and is scared to go back teaching in person, which she has to do, and went to Walgreens, and they give you a form that says, you know, did you get your first 2 shots, and why you're getting the 3rd shot? And it says, do you have this, 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 and this? And she checks off all, no, I don't have any of those. And then it says, you can also check other, and we don't ask you why you're checking other. So she checked other, and they said to her, well, what's the reason? He said, well, you just said on the form, you don't have the right to ask me. So they gave her the vaccine. So anybody could walk in to get the Pfizer because it's FDA approved, and you can get it if you just push a little bit.
Walgreens just told me that you have to have a reason, like a
You don't.
compromised immune system.
You
But
don't.
They just
No.
told me that from the pharmacy on the telephone.
Yeah, they may say that, but if you read their form, they don't. And if you insist, you check other, and you insist that you don't have to tell them, they'll give you the vaccine.
But John, is that just for the Pfizer? Because most of us probably have gotten the Moderna.
It's just the Pfizer, because that's the one that's fully approved by the FDA. The
Okay.
Moderna will probably get approved in the next couple of weeks. And whether to mix and match, I mean, it will probably be yes, but that remains to be determined. Cheryl, you said you were going to write down other questions. Did you have any others?
No, I guess the one concern, I was pretty much, I feel like especially our group, we've got age against us, and I'm sure a lot of us have different other kinds of health issues. I was concerned that today when I read that actually there were in total, I think, of 3 people who have died in the last couple of days from COVID who were vaccinated, 2 yesterday, and 2 on the 13th and 1 on the 11th. And I was okay with the first one. She was elderly. They said she had all these health conditions. But then when there were 2 more, that worried me because before I was obsessively careful, but now I do see grandchildren. I'm going to travel, see other ones. One's going to preschool. I feel like I can't go back to the 18 months of not doing any of that. So that's why the booster became something like, I really want a booster. But I was concerned to hear that 3 in our small county have died, unless they were very old and very compromised. So I don't know if you know anything about that. So that was the big one.
I haven't heard about the other 2, just the first one. So
Who are on the 13th, yeah.
Yeah. So, it's scary. There are people that still in nursing homes, the staff are not all vaccinated.
Mm-hmm.
Home care aides, not all vaccinated. I assume that's where a lot of this is coming from. And also the people that are in nursing homes that are getting vaccinated, their antibodies wane faster. We all know that as we get older, the vaccines don't work as well in us, also for not entirely clear reasons. So the risk, though, is still much greater for the unvaccinated people that are almost all the ones that are spreading it. The vaccinated people, when they get symptoms, turn out to have the same rough amounts of virus that you can recover from their nose or their cough, if they've got it, but they have it for a shorter period of time than the unvaccinated.
Mhm.
And so they're less likely to spread it, but yes, they can spread it.
Mhm.
And the thing again about the masks is if you're talking just a regular surgical mask, there's rarely little particles, microscopic, that would
Mhm.
come
Get past that.
out. If you're yelling, singing, coughing with a regular mask, you'll have more particles come out. You then would need to have the N95 mask to be, if you've got symptoms and you've got to be around somebody, you might think about using the N95 mask around people that are more at risk. But still, you shouldn't be around people that are at risk if you have any symptoms, even if you think, oh, it's hay fever. No, a number of people think it's hay fever, they're going to get tested, and it's COVID.
John,
The problem we have with this whole issue of breakthrough is we have no clue what the level of immunity was in the individual who got infected and died. We equate vaccination with immunization, and that's not correct in every instance. The vaccines probably are near perfect. The individual who gets the vaccine is not near perfect. And we have a whole host of immune response genes, many of which we don't know exactly what impact they have on the clearing of the virus. And many are not even testable by normal standards that we have. So 100 people get a vaccine, there's going to be a small percent that do not respond to that vaccine in an effective manner. And so unless we have data prior to somebody getting sick, we really don't have a clue as to what the level of immunity is necessary for protection. And secondly, of these breakthroughs, we haven't got a clue what that individual's immune response was prior to the infection. So the vaccine efficacies are probably even greater than what we're giving them credit for. What isn't a very effective is the individual's immune response.
No, that's quite right.
The county health department did send an email today that said that the other two were both elders. They didn't say anything further. And we have a case in the family where we have one person who has COVID now and who's vaccinated, but who has a compromised immune system. And clearly, just what Ed said is probably the case. The monoclonal antibodies seem to be dealing with it, but her spouse has been negative so far and hasn't felt anything. So it kind of brought home, Ed, what you're saying is known statistically probably in the field, which is everyone's different, and there's just so many different ways of reacting to this that it's hard to predict.
There's also a possibility that as many as 30% of people may have some prior immunity. This was raised actually early in the pandemic, and I saw something on the news about it in the past day where people have picked up on this again. It's not really clear. Again, these antibody tests and these other more specific tests, the T cells and memory B cells, which are hard to test for, they're not standardized ways of testing these always. But there were people early on in the pandemic that were finding antibodies to it in up to 30% of some studies. Usually it was less than that. And yet it said that the four forever do not give long-lasting immunity. That's why kids tend to get sick with one cold after another, but it's not all coronaviruses. But I'm not sure that's ever really been rigorously tested because it was never so important before. So there is this possibility that one of the reasons why people don't get infected is because they have young kids or young grandkids around that give them colds frequently enough that they have some immunity to it. On the other hand, that may be totally false. No one knows.
John, you mentioned early on something to the effect of the possibility of getting a antibody test 3 or 4 weeks after a shot. Is there a formal name for that test, and how would one go about actually obtaining that?
You can ask your doctor to do it. There is a test. A friend of mine who's immune suppressed, got the correct test. I don't know how they label it now, but they can test for antibodies to the spike protein, which you should get, and anybody that's been vaccinated, that's what they're giving you. But they're also testing for a protein that's in the nuclear capsule of the vaccine, which you only get if you're infected. So what you'd want to do is have them ideally test for both. You could see whether, in fact, you might have had the virus and you didn't know it, to the nuclear protein, but you want to see that you have the spike protein. The reason why 3 weeks is people have looked at the antibody response, and it usually takes a couple of weeks, and then it starts to fade a little bit starting about a month later. So 3 weeks is the ideal spot. But again, it's not recommended. In fact, it's recommended that you don't do it. Consider for some peace of mind, even though it doesn't prove anything.
John?
Thank you again for today. I assume you're recommending that everybody get their flu shot as soon as possible.
That is a whole nother topic. And let me just say very briefly, it's been suggested for years that we get a flu shot, as early as possible, August, September, etc. And yet, when you look at the antibodies following the flu shot, they also decline as the months go by, so that your protection is at most about 70% in a couple of months after the flu shot. By 4 and 5 months later, it's only about 30%. Well, why don't we give routine booster vaccinations to the flu shot? People have asked this questions for years, and there is no short answer. It's mostly that's about probably all that we can reasonably give to people in a winter's time, because you have to be dragging people out in January and February to give them a booster to everybody who's over a certain age. That's one thing, and nobody's really tested that. But there are physicians, immunologists that have been doing this to themselves for years. They give themselves a booster shot every year, particularly if you're older. So having said that, it's probably reasonable to wait until, say, mid-October. At least it'll last through most of the winter better. However, if you advised everybody in the country to wait until October 15th, you probably couldn't vaccinate enough people. Therefore, people start vaccinating the end of August, which is probably not good, especially for people who are older. So if you can get it a bit later, you're better off. The flu doesn't usually hit until December, November, December, January, February. Plus which, if we're all wearing masks indoors all the time, nobody got the flu last year and probably won't get the flu this year. So everybody will have to make their own decision. I wait until middle of November myself. My wife usually takes it earlier because she's seeing people.
Quick question, John. When do you expect that we will know about boosters? You said there was going to be a meeting this weekend. Should we expect a proclamation from that or a decision on that?
I don't know when they'll make the decision, but sometime before the end of the month, probably. That will be whether advising it. There's another national committee in which a local physician is actually on it, which looks at adult immunization recommendations for the whole country. And talking to him yesterday, he was saying they haven't decided, but they're probably going to come down to people over 75 and people with other health risks. And what those health risks will be be determined. So there may be conflicting recommendations coming out also. Don't ask me how the pharmacists are going to decide all this, but we'll see.
Thank you.
And you can get the flu shot and the booster shot at the same time. If,
You can.
Yeah, that's recommended, and it doesn't seem to be any extra problem
Good to know.
to do so. Any other questions?
John, this is Hal Kraft. I wonder, is the natural immunity from having COVID equivalent to a vaccine, or if those who have already had COVID should get a vaccine anyway?
That's an interesting question. It depends. If you're really ill with COVID and you didn't get steroids, say, and you didn't get antibodies like Trump got, because when he got the antibodies early on in the steroids, he probably didn't get a good antibody response to his illness. So if you're ill enough with it, you'll probably have good antibodies for, as long as the vaccine. If you're mildly ill or you just test positive and you don't really have any symptoms, it's very iffy whether you get a reasonable antibody response. When they have looked at people that had COVID, at least very mild symptoms to moderate, and they gave a vaccine, their antibody response was then much better. So it's recommended, though, since you don't know what the level of protection is, that even the people that were very ill with it get a vaccine again 3 months later. It can't hurt, doesn't seem to be causing any extra side effects, and it's a good booster for them. One of the questions to be decided is people that have had COVID and then they already had a booster, should they get another booster? Nobody knows.
Very helpful, thank you.
Yeah. Well, if there are no more questions, we're at 5:32. So I'll say
Thank you, John.
Thank you, John.
all for
Very much.
listening,
Thank
and don't be too confused. Things will continue to change.
Thanks, John.
Thank you.
Thank you very much.
All right. Yeah,
Thank you.
take care.